Oxfam India's 2021 report highlights that India's health inequality was made worse by a reduced health budget. The report says that the absence of universal health coverage has starkly and disproportionately affected marginalised groups at a time when socio-economic inequalities in India are growing because of the COVID-19 pandemic. NDTV's Parmeshwar Bawa breaks down the details.
Sharp inequalities exist across different caste, religious, class and gender categories on various health indicators, according to the latest report by Oxfam India. A report titled India Inequality Report 2021, India's Unequal Healthcare Story by Oxfam India shows that 65.7% of the households belonging to the general category have access to improved non-shared sanitation facilities, while only 25.9% scheduled tribe households have improved non-shared sanitation facilities. Now, 12.6% more children are stunted in scheduled caste households than those in households belonging to the general category. And the chances of a child dying before his 5th birthday is 3 times higher for the bottom 20% of the population as compared to the top 20%. Now, the report had some shocking claims based on a primary survey. Now, 1 of every 6 rupees spent on hospitalization came through borrowing. Currently, there are 5 beds per 10,000 people, which is down from the 9 beds per 10,000 people as per the 2012 Human Development Report. And much to our dismay, the report states that there is 1 state-run hospital for every 90,343 people. Now, the number of hospital beds per 1,000 population in India is lower than some of the lesser developed countries such as Bangladesh, Kenya and Chile. The Oxfam India report shows that constant underfunding of public healthcare system in the last decade has also worsened health infrastructure. So while the report claims that the general category is better off than the SCs and STs, it also highlights that Hindus are better off than Muslims, men are better off than women, and the urban population is better off than the rural population on most health determinants, interventions, as well as health indicators. Now, there are 2 facets to what the Oxfam report has found. The first is states that have for the past few years been reducing inequalities, such as inequalities to access to health between the general category and the SC and ST populations, have less confirmed cases of COVID, such as Telangana, Himachal Pradesh and Rajasthan. Now, on the other hand, states that have had higher GDP expenditure on health, such as Assam, Bihar and Goa, have higher recovery rates of COVID cases. The report points out that the vaccination drive against COVID-19 ignores the country's digital divide. Entering the pandemic, only 15% rural households had an internet connection, and more than 60% of women across 12 states had never used the internet, the report highlighted. Another stark observation in the report outlines the out-of-pocket health expenditure of 64.2% in India is higher than the world average of 18.2%. Now, some of the Oxfam report recommendations include increasing health spending to 2.5% of the GDP to ensure a more equitable health system in the country. It also asserts that the right to health should be enacted as a fundamental right that makes it obligatory for the government to ensure equal access to timely and affordable health care, as well as widening the ambit of insurance schemes to include outpatient care.